There was an article in the paper recently about how doctors treat colds and flus. So today I'm presenting how natural doctors treat colds and flus. And there is one area where they both agree. And so if you continue, you'll get the advice where natural doctors and mainstream doctors agree on. So if you like this presentation, please hit like and give your comments below. Okay, so what did the article when they said doctors, what do the doctors take for colds and flus? And so the first thing you should know is that many doctors don't like taking cold medicine. Yeah, I'll see that again. Many doctors, mainstream doctors, do not like taking cold medicine. Why is that? Because there's no evidence that it's effective. Okay, so we're being told drugs must be proven safe and effective. Not true at all. Many drugs are grandfathered, or we talked recently, I talked about sleep medication. Yeah, they do a study where they study the sleep medication for 2 weeks, but then people take it for months and years. That's no evidence. One of the most common Western cough remedies is called guaifenesin. And guaifenesin basically helps loosen up mucus. And there's also something called DM, which is a cough suppressant. And many doctors use these, guaifenesin and also DM, dextromethorphan. But then they typically will avoid antihistamines because they can make the mucus thicker and more hard to cough up. Now, one of the doctors that they interviewed uses the oral decongestant pseudoephedrine. So, for instance, the medication Sudafed contains pseudoephedrine. And there's also a Chinese herb called ma huang, which also contains pseudoephedrine. And what we learned about pseudoephedrine and ma huang is that it's not very good for the heart. Pseudoephedrine and ma huang actually can cause the heart rate to increase and also can cause blood pressure to rise, both on a one-time occurrence, but also they can over time cause a long-lasting raise to the blood pressure. Nasal congestants can actually increase the swelling if used long-term. So one of the doctors named Dr. Ransom basically uses these medications very, very short-term. Another doctor chose to use Chloraseptic, which is an over-the-counter throat spray. And I remember taking that as a kid, and it worked pretty well for really bad. It's a spray that is sprayed in the back of your throat. But again, we don't know how this really works in terms of helping people get over their cold or flu. Now, there was a doctor named Dr. Dubin, and he is an ear, nose, and throat specialist, and he uses saline solution to irrigate his nasal passages. So actually, I'm uncovering two similarities between mainstream doctors and natural doctors. So both recommend saline spray for irrigating the sinus passages. And this is really good for people that have a sinus infection in addition to herbs or medication if they need it. Could also be used to prevent hay fever and seasonal allergies. And then this irrigating this sinus nasal passages also is very good for congestion, one of the best things for congestion. And so people will use salt solution. There's packets that are available in drugstores or health food stores that you want to add to the water. And then some herbalists will actually recommend a few drops of golden seal, a few drops of myrrh, or a few drops of herba santa. But some of the take-home messages here is you don't want to use straight tap water because that can be very irritating. You also don't want to use, you want to typically use water that's warmed slightly, not too hot, not too cold. And then if you do want to add herbs, it's just a few drops of a tincture bottle. It's not very much. So basically, that will be a good idea to help reduce swelling and sinus infections and that sort of thing. And so now I want to discuss the other remedy besides nasal irrigation that both mainstream and natural doctors employ, and that is chicken soup. You got that. So chicken soup provides fluids, electrolytes, lean protein, and carbohydrates. But I bet you didn't know that chicken soup has anti-inflammatory properties. Yeah, so chicken soup is a great healer, not only for colds and flus, but also digestive disorders. And finally, they interviewed a doctor, a pediatrician named Dr. Rome. And what Dr. Rome takes is elderberry tablets when she's feeling ill. And she says, but Dr. Rome says there isn't any definitive evidence to support taking it. And Dr. Rome also takes high dosages of vitamin C during the first 2 days of symptoms. I have found no literature to support this, but it seems to be the trick for our family, says Dr. Rome, head of the Center for Adolescent Medicine at the Cleveland Clinic Children's Hospital. So elderberry tablets are something that people can take, practitioners can take, general people can take, even kids can take. I haven't had great results using elderberry tablets. I typically will use things like vitamin A, vitamin C, zinc, and then I'll use Chinese herbs. But many practitioners, many natural doctors will use elderberry tablets. Another thing that's very common is zinc, particularly chewable zinc. And then, doctors say these things like, I have found no literature to support vitamin C. I guess she hasn't looked at the literature because Linus Pauling did the literature on vitamin C and the common colds something like 50 years ago, maybe only 40 years ago. And so there's definitely some evidence that vitamin C helps people get over the cold and flu. And then for flu support, one of the things that one of my colleagues, Dr. Ray, recommends is intravenous nutrients, especially intravenous vitamin C. So when Ray feels sick, sometimes he'll have his wife, Linda, hook him up to an IV and he'll be getting a vitamin C. So for Ray's patients that have influenza, such as regular influenza or something like meningitis, things like that. Of course, if it's bacterial meningitis, they need to be treated in the hospital. But for viral meningitis, for influenza, for COVID-19, Ray typically recommends 25 grams of vitamin C in an infusion. And then you do that for 3 days, if possible, right in a row. And he reports that that is very effective for reducing the duration of the common cold and flu. Okay, so now I want to just review some of my recommendations for cold and flu. Number one, we talked about saline solution to help you decongest your nasal passages. One of the things I haven't talked about is onion and garlic syrup. And onion and garlic syrup has antiviral and antibacterial properties. It could also be used to help coat the throat. I also recommend propolis, which has antiviral and antibiotic effects. And propolis is just a great gargle. And then they also use from time to time a propolis throat spray. So Andrew nowadays, instead of using chloroseptic, uses propolis throat spray. Echinacea is a great herb to help reduce the incidence of your influenza. In other words, if you take it in the early stages and a high enough dosage, it will cut the duration of the flu. And I do want to say that dosage is key with echinacea, and almost everybody that takes echinacea takes too little. When I take echinacea or recommend echinacea for cold or flu, I'm recommending it every few hours. And then finally, some teas. These are really good to help loosen mucus and also help push liquids. I like ginger and turmeric tea. And so you could either select a tea bag that has ginger and turmeric, or you could simply add powders of ginger and turmeric. I do want to mention that powdered ginger is very strong. So if you do put it in hot water, start with, say, a quarter teaspoon. Turmeric can be used more in higher dosages, but again, Too much can be a little bit aggravating to the bowels. And then finally, want to recommend the idea of if somebody gets frequent colds or flus, to visit an acupuncturist who is a specialist in Chinese herbs, because they can recommend specific tailored formulas to help the person prevent colds and flus and also recover from colds and flus. This concludes our podcast for today. If you'd like to see more videos like this, please comment below and let us know what topics you'd like to hear about. And be sure to like and subscribe to help us grow our channel. If you'd like to know more about us, please visit our website at getwellfoundation.org. Thanks for joining us, and we'll see you next time.